This is Senator John Tester. I am here in Bozeman, Montana at Community Health Partners, which is a community health clinic that serves this region. Also have satellite offices in Livingston and Belgrade and West Yellowstone. They provide dental services and medical services to make sure that this region has access to affordable and, might I say, some pretty darn good health care. Now you might ask out there, well, why are you sitting in Bozeman, Montana at Community Health Partners? And it's because this morning, Eastern time at about 1:30 a.m., we passed a bill that will fund the community health centers in Montana, and Community Health Partners is one of those health centers that will be able to receive some of that funding. Some $7 billion over 2 years, so it's $3.5 billion a year throughout the whole country. Montana will get a piece of that action, and we'll be able to save this piece of healthcare infrastructure, if we want to talk it in the most basic of terms, that serves this region. I have been harping on the Senate floor now for several months that these folks needed some predictability. And last night, we finally got some predictability. And I am here with Lander Cooney, who is the Chief Executive Officer of Community Health Partners. And I was just going to quiz her a little bit to see how her TV skills are, her Facebook Live skills are, I might add, to find out how this clinic was doing leading up to now. And that's really where I want to start. Before the action was done last night in the Senate, what were you guys talking about? What was the conversation in this room and in other rooms around Community Health Partners?
Great question. So, I think this morning we felt a huge collective sigh of relief that came from our 135 employees, the more than 11,000 patients we serve in Park and Gallatin counties. I think the conversations we've been having over the last 130 plus days since our funding expired were thoughtful and were measured, coming from a place, fortunately for us, of financial stability, but also a place of great uncertainty about what the future would hold for our patients and for the communities that we serve. As you know, more than 20% of our patients are uninsured. The majority of our patients live below twice the federal poverty level, and they come to us for a variety of services, not just health care. They come to us because of the type of health care we provide that is really patient-centered and whole-person focused, that includes dental, it includes behavioral health, and it includes a variety of other supportive services. And our patients and our staff were really nervous that we were not going to be able to serve our communities to the best of our abilities.
And so since the end of the fiscal year, which was the end of September, you guys have been literally walking a tight wire here, not knowing if you were going to have money to be able to stay open to serve your patients or not. Did you talk to your patients about this at all? Did the patients talk to you? Were they aware? Were the patients aware of what was going on?
Absolutely, and I think our message to our employees and to our board members and to our patients was, Community Health Partners has been thinking and planning for times of uncertainty. We've never quite experienced this before, but we knew we needed to be ready as a responsible organization and as a good steward of federal dollars that have come to us in the past. And so we were able to say, we're okay, and we have stable footing to ride out some degree of uncertainty, and we felt sort of paralyzed to respond to changes that were cropping up into our communities. You know that the state of Montana has made some changes at the state funding level, and that has affected a number of the patients we serve that are receiving mental health services or targeted case management or services at offices of public assistance that have now closed. And so we felt very burdened by not being able to step into some of those gaps that we knew were there because of the uncertainty that was out there. And we feel like it's our responsibility to know what's going on in the communities we serve and try to adjust our services to meet those needs. And we felt very unprepared to be able to do that.
Yeah, and you might have touched on this, but you've been here how long? How long is Community Health Partners? You said you started in Livingston.
20 years this year.
They've been here 20 years this year. Congratulations.
Thank you.
And you serve how many patients? 11,000, is that what you said?
Yep.
We happen to be sitting in the fastest growing area of the state of Montana. This area in population is growing at about 4% a year. And so you're seeing, I would imagine, an influx of patients every year. And is your patient load growing every year, or are you capped out because of personnel or because of facilities?
Yeah, there's a whole bunch of different factors there, right? What we see is no shortage of need. And we look around sometimes in Bozeman and Belgrade and we think, wow, it's booming. Everyone's doing well in this new economy. And the reality is that not everybody's doing well. Lots of people are piecing multiple part-time jobs together. The cost of housing is such a burden on individuals and families, and that those stresses mean that we need as communities to have resources available. And healthcare, affordable healthcare, is what keeps people at work, keeps people in school. And so what we're trying to do is take care of our community as it grows and be there for the portions of our population that need us the most.
Well, it's interesting because you said you're at about 11,000 people that you serve. The statistics I have is that in the entire state of Montana, community health centers, and there's, 16 of them in total, serve about a little over 100,000 folks. So you guys... because is there 100,000 people live in this valley, in this region? There might be, actually.
Working out and together, definitely.
Yeah. So you're right on target. I hesitate to ask this question because I don't know the answer to it, and I want you to answer it the right way. But did you lose any staff because of the uncertainty?
I don't think so. I think we certainly were getting questions from folks in the recruiting process. It wasn't, people knew that this was an issue and that it was a new sort of unprecedented issue. And we couldn't pretend it wasn't, right? I think if this becomes a pattern for the Community Health Center program going forward, it will significantly impede our ability to recruit and retain staff. So
the point you're really getting to is that we gave funding for 2 years. Now, for the last 130 days, you guys didn't know if you were going to have funding. So we're in better shape than we were, a lot better shape. But the truth is there's an act called the CHIME Act that gives you 5 years of funding. That is really where Congress needs to take the next step to and be able to give you the kind of predictability to plan not only for your patients but also for much more being able to run this operation in a much more fiscally responsible way, wouldn't you say?
Absolutely. Yeah.
So that's the right answer for that too. So look, going forward now, we've got the funding taken care of for 2 years. What are you doing now that you weren't doing a week ago?
What you mean we weren't doing yesterday?
Yeah. Okay. Yesterday. Right.
I think, like I said, we're going to try to thank folks like you who have been speaking up and helping make sure that these essential programs have the resources we need to do what we're supposed to do. So thank you.
You're welcome.
Start here.
Thank you for the work you do.
Sure. And then we're going to get back to work. You know, this has been a huge distraction from the work we do. And we are good at telling stories about the work we do and the patients we serve, and we're always happy to do that. And we more just want to get to work and provide the care that is needed in our community. So we're going to go revisit the projects that have been on hold for a few months, and many of them are around behavioral health. We're being called upon to step into addressing the substance use disorder epidemic that our country is facing. We have a lot to learn about that, but we want to be a partner and a piece of the solution. So we have some work to do there, and everything else.
Well, I just want to say all the things that Community Health Partners does in this Gallatin Valley is critically important. And you talked about substance abuse, which is a problem that is impacting every state in the union. And I often think that we just have Montanans watching us on this, but we don't. We've got folks from all over the country. So that the folks outside Montana that may not understand Montana as well as the Montanans do, we are a very rural state. And when we lose a healthcare facility, or a healthcare facility is potentially at risk of being lost, it's not usually easy to find access to healthcare just by going a few blocks down the street. Sometimes you have to go a lot further than that. And while these folks take care of folks that have some financial difficulty, and there's no shame in that, not for the grace of God, we'd all be in that position. It's really important to know that without these healthcare facilities, whether it's in Livingston or Bozeman or Belgrade or West Yellowstone, that the people wouldn't have access to healthcare. And quite frankly, and you alluded to it, if you have a sick employee, you don't have good production. They stay home, they don't make wages to take care of their family oftentimes, and it becomes a real problem. So, Lander Cooney, CEO of Community Health Partners. I just want to thank you guys very much. And I would just tell you, as a U.S. Senator from Montana, the folks, and Lander's not the only one in this room, the folks in this room spoke loud and clear and let the delegation know how important this was last night. And I will tell you, as critical as I am of Washington, D.C., and I am often very, very critical of the way things go, what we did last night was pretty darn cool.
We agree.
So thanks. And we just had come through the door, who's been working her fingers to the bone, Christy King, who's a nurse practitioner here. Hello. And we are on Facebook Live, Christy, so say hello. Say hello to the world.
Hello,
okay,
world.
That's it. And so tell me what you do.
Sure, I'm a family nurse practitioner, so I serve folks here from cradle to grave, taking care of their healthcare needs. Yeah.
And how long have you been here?
I've been here about 3.5 years.
Okay. And so can you tell me if your patients talk to you about this 130-day lag and no funding, and what they were saying to you?
They did. Patients were super nervous about what's going to happen to their health care because we're the last stop for a lot of these folks. They've been declined other places. We will work with patients regardless of their ability to pay and provide these wraparound services for them that they don't get elsewhere. And so they rely on us for their care, for their medication, for their counseling. And it just seemed like that was all going to be taken away. And so these folks have nowhere else to go. And there's a real sense of urgency and concern there.
And so now we've got some funding, and for at least the next couple years.
Thank you for that.
Absolutely. and now hopefully there will be less pressure on the future will be more certain, let's put it that way. So what do you anticipate? You talked about wraparound services. I mean, you'll be able to continue to grow those services. And talk about what wraparound services are, by the way.
Sure.
Really quick.
Sure.
And so we can talk about how we're going to grow those over the next couple of years.
Yeah. Well, I think community health centers in general are very unique because not only are we having you come in the door and treating your health issues, we're working on making sure you have all the other components that help you to be healthy. If you need housing, we'll help you get connected with the appropriate folks for that. If you need dental care, we have a dental clinic and can set you up with that. If you need help with your medications because you can't afford those because you're uninsured or underinsured, we have a program that can help with that, and people who can help you through every step of the way. So it's not just like, here's a form, figure it out. It's we really want to take care of you and prevent those problems before they get to be, a huge train wreck.
Yeah, that's good. And how many of the people you treat, what percentage are kids under the age of 18?
20%.
20%? 20%.
That's
Good.
hard to know those numbers.
That's good. That's good. That's good. And that's about all I got for you. The person I really want to quiz here. I've got two more. Do I got time for two more? I got time for two more. My direct. Hey,
Thank you.
Thank you for your great work.
Thank you.
Thanks for not leaving any of your patients to come talk to me. Right? Okay. Cool. Katie Madison, who is the clinical director.
The clinic director.
The clinic director. Is there a difference if I say clinical versus clinic?
I run
Good
the
to meet
clinic,
you.
but not the clinical.
Okay, so you run the clinic. So you're running. Come on in a little. So you're running the physical facility. Is that what you run?
Yeah.
Tell me what you do.
Oh, geez. So I make sure that the right people show up at the right time to take care of folks. I make sure the schedule is covered. I look after my staff. I help make sure that supplies are in and supplies are getting ready.
So how many people work? Can you in this Bozeman facility? How many people work?
35.
35. Are you clinic director for all of them?
No, I run the Bozeman clinic, and
Yes.
then I've got some team members here at the Belgrade clinic. Our Livingston clinic director is in Livingston.
Yes.
And then our West Yellowstone clinic director is here as well.
Cool. And do you have all nurse practitioners, physician's assistants, MDs? What do you have?
So since I've been here, we've had all of the above. So right now we have one MD who is taking care of patients here at the Bozeman clinic. We have 2 NPs, and we have 1 PA. We are currently bringing another MD on who will start with us in April. And I was able to call him today and say, we're funded.
Come on
So
down.
thank you.
Come on down.
Yeah.
Well, that's good. And so you got 35 in total. Sounds like half a dozen docs, PAs, MTs.
So I have 4 providers who are doing clinical or medical providing.
Yeah.
I've got behavioral health therapists as well. And then we have nurses, medical assistants. We've got administrative generalists who help with scheduling.
Okay.
We've got a resource coordinator. Christy was talking about wraparound services. We refer to her as our miracle worker. She would not come and sit here, but Jen Vero deserves an incredible shout out for the work that she does every day, as do all my guys. I mean, they solve unsolvable problems. That's what we do.
And that's why it's so important to keep you guys going.
And one of my other colleagues, just really fast, Nick Redmond, who's our data analyst, recently had a letter to the editor here in Bozeman, and he referred to this group of people as radically compassionate. And I got choked up when I read that, and that's exactly who these people are.
You've never seen yourself as a radical before, have you?
Oh, maybe that's not true. There's that possibility. It was just such a perfect phrase, though. It really was impressive.
Well, thank you for everything.
Thank you.
Appreciate it. Yeah. Now the toughest interview of all is Dana Jackson, the board member. Here we go.
Yeah.
So good to see you.
You too.
How long have you been on the board?
Going on 4 years.
4 years. And how many people are on this board?
11.
And what kind of decisions do you make typically? How often do you meet, by the way?
We meet once a month,
Okay.
the entire board. There's an executive board that meets once a month also,
Right.
and then there's several committees that will work on facilities or whatever we've got coming up.
So I'll cut right to it. You guys on the board are the ones that have to make the tough decisions, right?
Yeah.
So had you started building a contingency plan for what happens if you don't get the money?
We did. We discussed it a few months back.
Yeah.
And it was very tough, when you have to start saying what can we do to make it go so much further, or what do we have to take away in order to survive? And it's when you get down to it, it's people. And that's what's the tough thing. It's going to be people.
Yeah.
And we need those people to help with the patients.
So now that the funding's there, do you anticipate your next board meeting you'll be looking more proactively instead of?
Yes, we've put a lot of stuff on the back burner because of it, and I know a lot of with the staff. They have some stuff they want to implement, and we've kind of put a standstill on everything until we knew You know, we were looking at our reserves and saying, how long can we last? You know, that type of thing, which gets real scary.
Yeah, it does. Well, and how many people did you say were on the board?
11.
11 people. And does each one of the clinics, the Belgrade, have its own board too? No. You see the whole works?
So we see it.
Holy
we meet
mackerel.
at the 1 week or 1 month we're in Livingston, 1 month we're in Belgrade. We meet here. We just go all over.
So, last question.
Yes.
What made you want to get on this board?
These people and their mission, it is an honor, an absolute honor to be on this board.
Cool.
I get choked up.
We're happy you're on it because you got to have people who are passionate. And
There
you're
you go.
obviously
There you
passionate,
go.
so thanks.
Yes.
So, just to close this thing out, I would just say this. These folks are here and they're committed to healthcare in rural states like Montana. These folks are serving a population that in some cases wouldn't get served at all without them. That's why when we have a 1:30 vote in the morning in Washington, D.C., it's worth having. Because without funding for facilities like this, we're going to have a lot of people in a world of hurt. And if I make one plug to anybody who might be serving in the Senate that's watching this, or anybody who might be able to influence people who are serving in the United States Senate and in the United States House, tell these folks to pass the CHIME Act. This is money well spent. This is money that helps keep America America. And we hung these guys out for 130 days, and that is totally irresponsible.